So this research is really to understand the intergenerational transmission of chronic pain within veterans and their children. So pain in childhood is a huge public health emergency. It affects 1 in 5 children, things like headaches, stomach aches, musculoskeletal pain. And yet the pain in children of veterans has largely been ignored. We know that many veterans have chronic pain, which could put their children at risk for developing chronic pain. But we also know that many children and families are also resilient. Veterans care about the health of their children, and taking a family-based approach to understanding pain in these families will ensure that pain is recognized in kids, not only veterans, but their children, and that access to care is facilitated early in development to prevent long-term problems. Many veterans experience chronic pain, and many veterans care about, what impact their own pain and mental health may have on their children. And so by us examining pain and mental health, not just in veterans, but also in their children, this will shine a spotlight on whether pain is an issue in children, and also call for it to be assessed, to be recognized, and to be treated. So this study is going to examine this for the first time in about 250 veterans and their children. And we're going to look at pain in both the veterans, pain and mental health, but also their children to understand this relationship and this intergenerational transmission of pain from parents to children. Also want to get a really in-depth understanding of how pain unfolds within the family. And to do that, we really need to use qualitative methodology, in-depth interviews with both veterans, their spouses, and their children to really understand how pain unfolds within the family using open-ended questions. And we hope to do that qualitative study in about 20 families. The long-term plan is really to understand how can we not only increase recognition of this problem, but also how can we address it? How can we link these children to resources and interventions early so that that can prevent chronic pain problems and mental health problems from persisting into adulthood?